Good afternoon, everyone. Welcome to today's press conference. We have with us the Chief Executive, Mr. John Lee, the Chief Secretary, Mr. Eric Chen, Secretary for Security, Mr. Chris Tang, Secretary for Health, Professor Lo Chong Mao, Secretary for Transport and Logistics, Mr. Lo Sai Hong, and Acting Government Chief Information Officer, Mr. Tony Wong. We hear from the Chief Executive first, to be followed by other principal officials. There will be question and answer sessions. Please ask no more than 2 questions. CE, please. Good afternoon, everyone. Today is the first press conference in 2023 called by me. First of all, I would like to wish you all a happy new year and a prosperous new year. I call this press conference to make an announcement. The announcement is the implementation details of opening of the border between Hong Kong and the mainland. I would like to thank the central authorities for making arrangements for the orderly and gradual opening of the border. I would also like to thank the Chief Secretary for leading the border reopening task force. Discussions have been made with central authorities, ministries, commissions for coordination and agreement. There is a consensus reached, and the consensus is approved by the central authorities. The first stage will take place on the 8th of January, that is this Sunday. For one-way travel, the number of quota is about 60,000. That means there will be a maximum of 60,000 Hong Kong people traveling via sea, land, or air border via different boundary control points to travel to mainland China. That includes 50,000 via land border control points and about 10,000 people via sea, air, border control points, as well as the bridge. In this regard, there are about 7 border control points. 3 of them are currently operating, and 4 will resume operation. For sea, air, and bridge control points, all 4 border control points will be fully opened without any capacity limits. That is the Hong Kong-Macau Ferry Terminal, the China-Hong Kong Ferry Terminal, as well as the Hong Kong-Zhuhai-Macau Bridge. Based on their capacity, we reckon that for one-way travel per day, there will be about 10,000 people traveling northward. That means as long as you have a ticket for a flight, a ferry, or for a car, then you can go. For 3 land border control points, that is Shenzhen Bay, Mankamto, and Lok Ma Chau Spur Line, in order to enable orderly and gradual as well as smooth travel, we will take it step by step. Total number of people traveling either way will be 50,000 each. And for people from both sides, they will have to make online appointments via respective platforms. And in order to ensure that Hong Kong residents coming back to Hong Kong and mainlanders returning to mainland, governments of the 2 sides agreed that they will not be counted towards the 50,000 capacity limit. For example, traveling northward to the mainland, for Hong Kong, there can be 50,000 Hong Kong people via land control points traveling to the mainland. This number excludes mainlanders returning to the mainland. And for the 50,000 Hong Kong people include Hong Kong residents with foreign passports, and I believe this is a small number. In relation to southbound travel, the same arrangements. As to the number of Hong Kong people traveling to the mainland via different control points, I can tell you that the maximum number is 60,000. When they enter the mainland, there is no need to go through on-site quarantine. With 60,000 people going to the mainland every day, that means there'll be about 1.8 million Hong Kong people entering mainland China over a month. For 2 months, there will be over 3.6 million people, which is about 50% of our population. We will closely monitor the situation and we will liaise closely with municipal governments of Guangdong and Shenzhen in order to make sure that there will be gradual and orderly opening of the border and to decide the next step and the details. I will now give the floor to the Chief Secretary for further information, and then the secretaries will give you more information about their respective purview. Chief Secretary. Happy New Year, everyone. As the Chief Executive said, we thank the central authorities for their agreement of orderly, gradual, and full opening of the border. I led 15 policy bureaus in the coordination group on resumption of normal travel. We all work towards the same goal for opening of the border. We want to put in place sound proposals, and at the same time, we closely liaise with relevant parties on the mainland. After we formulated the proposal, we submitted it to the central authorities for approval. I thank the municipal governments of the mainland for their full support. As Chief Executive said, there will be gradual and orderly opening of the border starting on the 8th of January. In the first stage, there will be 3 major areas, and I'll go through them one by one. First, opening of border control points. There are 2 categories. The first are sea, air, and bridge border control points. Control can be exercised over the selling of tickets. Apart from the Hong Kong-Zhuhai-Macau Bridge as well as the airport, the Hong Kong-Macau ferry terminal as well as the China-Hong Kong ferry terminal will resume operation. Maximum daily capacity will be set according to the capacity of these facilities. So there is no need for us to set separate capacity limits. And that excludes people who travel in private car or hired vehicles. They have to make alternative arrangements. We'll give you details shortly. The second category are land border control points, namely Mankamto, Shenzhen Bay, and Lok Ma Chau, Futian, Lok Ma Chau Spur Line, and Futian. There will be full resumption, and in order to make sure that there is a gradual and orderly operation, we will set capacity limit. There will be online booking requirement for people traveling via Hong Kong-Zhuhai-Macau Bridge in hire cars. That includes the driver and the passengers. Both sides will launch a platform for online booking to be made. In short, northbound travel, excluding mainland residents because they don't need to make any booking. Others will have to use the Hong Kong SAR online booking system to make advance appointment for a specific border control point before they can go through. The platform will be launched shortly today. Similarly, for southbound travel, all travelers except Hong Kong residents will have to make prior appointments using the Shenzhen online booking system. That means for Hong Kong residents coming back to Hong Kong, they do not have to make an appointment. There is no capacity limit for this group of people. In relation to the capacity for the three boundary points, one-way travel is 50,000. For Shenzhen, 10,000. Mankamto, 5,000. And Lok Ma Chau Spur Line, a maximum of 35,000 people. For people traveling in small vehicles via Hong Kong-Zhuhai Macau Bridge, for one-way travel, drivers included, we have set a limit of 1,000. Let me give you an example. If you travel via Shenzhen Bay, northbound maximum 10,000, southbound maximum 10,000 per day. For mainlanders returning to mainland and Hong Kong residents coming back to Hong Kong, they are not included in this category and there is no capacity limit. So for Hong Kong residents coming back to Hong Kong, they will still be able to travel without an appointment. That is very important because we don't want them to be unable to come back simply because they cannot make an appointment. In relation to infection prevention control, Hong Kong people returning to Hong Kong and mainlanders returning to China, they will have to show a negative PCR result done within 48 hours before they're allowed to cross.
We liaise very closely with our counterparts across the border to monitor the operation of the first stage of reopening, and then we will assess the situation and make an announcement in due course. For further phases, we will consider increasing the number of border control points, and we may add the XRL, the express railway, and other border points such as Wong Kwang, Lok Ma Chau, and Liantang. And secondly, we will appropriately increase the daily quota. Thirdly, after the Chinese New Year, we will resume daily traveling of cross-border students to come to Hong Kong for face-to-face classes. We understand that these students have needs different from other travelers, so no prior booking is required. So we'll continue to discuss with mainland authorities to ascertain the quarantine requirements or the infection control measures required. We will maintain liaison with the education sector and the stakeholders. Now, for details of the phase one of reopening of the borders, the Secretary for Security will explain to you the detailed arrangements for different border control points. The Secretary for Transport and Logistics will explain the transport supporting facilities. And also Mr. Lo Chong Mao, Professor Lo, will explain the relevant healthcare facilities, our testing capacity, and also the arrangement of our healthcare system after reopening of the borders. The OGO will explain how online bookings can be made. I'll give the floor to the Secretary for Security first. Thank you. Good afternoon, everyone. I'd like to brief you on the details of reopening of the borders. The CE and the CS has already explained that phase one of reopening will start on the 8th of January, covering 7 border control points. They will resume their normal operating hours before the epidemic. Our airport will continue to operate around the clock, and for the Hong Kong Macau Ferry Terminal, China Hong Kong Ferry Terminal, and the Hong Kong Macau Bridge will operate around the clock. And for the remaining borders, Shenzhen one from 6 a.m. to 00 hours, Mankamto from 7 a.m. to 10 p.m. Fukien, i.e. the Lok Ma Chau Spur Line, from 6:30 in the morning to 10:30 p.m. for all passenger clearance, including those for vehicles. Now, if available at these control points will resume. The CS already explained that there will be an online booking system and also a quota set. Let me stress a few things. Northbound traffic from Hong Kong, with the exception of mainland residents, all travelers will have to use our online booking platform operated by the government before they can cross the border. For operation of the platform, the acting director for OGO will explain. And for southbound traffic, with the exception of Hong Kong residents or mainland travelers who return through Hong Kong, will have to use the online booking platform operated by the Shenzhen municipal government before they can cross the border. Now, for the booking arrangement, they apply to all passengers on private cars, those traveling on the Hong Kong-Macau Bridge. Now, I'm talking about the private vehicles. Both the drivers and passengers have to make a booking. And then on the platform, they have to specify the border control point. They're going to use the designated date and also the specific time slot. There will be 3 slots each day: morning, evening, and afternoon and evening. And upon successful booking, the traveler will have to arrive at the respective border control point at the specified time before they can cross the border. Now, this is a subject very close to the heart of everyone in Hong Kong. The Security Bureau and also our all the discipline services are well prepared for this operation. The Customs and Excise have deployed enough manpower to different border control points so that clearance and immigration procedures will be very smooth. The police, the immigration department, the Customs and Excise department, and the transport department and the MTRCL have earlier on carried out an interdepartmental drill covering a few hundred officers to ensure that the reopening will be smooth and orderly. And then we've also activated our commanding coordination center for emergency to ensure that everything is safe at our border control points. Should there be any incident, we will coordinate different departments for appropriate response to ensure efficient and effective traveling. May I remind all travelers, whether you are southbound or northbound, before you arrive at the respective border control point, you have to ensure that you fulfill the following requirements in terms of public health requirements for infection control and also all the immigration requirements. You have to produce a relevant document for inspection. For northbound passengers, you have to show the following documents before you can have clearance. First, a PCR test done within 48 hours before departure with a negative result. And if you are people who require booking, you have to show proof of a successful booking made. It can be paper-based or a screen cap or SMS. We expect that traffic will increase at our border control points, and travelers may not be familiar with the requirements and arrangements. And because when you at the border, you have to produce documents, and so traffic will be rather busy. And we urge travelers to be patient and follow instructions by staff. And before you arrive at our control points, please ensure that all required documents are ready, and to ensure that you are at the right border control point at the specific time you obtain by booking. So these are the arrangements. I give the floor to the Secretary for Health, Professor Low. Thank you, CE. Good afternoon, everyone. To prepare for normal flow of people between Hong Kong and the mainland, and to safeguard public health and manage health risks. Now, starting from the 8th of January, we will have an improved infection control measure. Everyone, whether you are from the mainland or from Hong Kong to the mainland, 48 hours before departure, will have to do a PCR test with a negative result. You have to either obtain a paper-based or e-copy of your report for inspection by our border control staff. And we will liaise with our mainland counterparts. Should there be any adjustment in these arrangements, we will let you know as soon as possible. I'd like to report to you how we can ensure that with increased traffic, passenger traffic between Hong Kong and the mainland, we can ensure that there will be testing services for travelers as well as our staff. And we explain to the public how, after increased traffic between the two places, we can safeguard our healthcare system. First, in terms of testing, to facilitate testing of travelers to the mainland, we have 85 community testing centers and stations in the territory. We offer a self-financed testing service so that you can do a PCR test 48 hours within 48 hours of departure. And then the fee is capped at $150. And then the contractor is required to issue a paper-based or an e-report for proof. Starting from the middle of this year, we have done a lot to boost the capacity of our community testing centers. We perform PCR tests for high-risk groups, and we believe at our community testing centers and stations will be able to cope with up to 100,000 self-financed samples on a daily basis. And to avoid any traffic jam and to make it easier for travelers, we strongly appeal to travelers, prospective travelers. You should do an online booking for a slot for test beforehand, and we will maintain communication with our contractors for the number of centers and their opening time. There will be appropriate adjustment. Apart from community testing centers and stations, private hospitals and private laboratories also offer self-financed PCR test services for prospective travelers. We have a list of recognized laboratories and testing contractors available on site, online for your inspection. There will be no on-site PCR tests upon arrival in the future. For travelers, inbound travelers, we have a piece of health advice. We suggest that for all inbound travelers, they should perform an RAT every day for 5 days in Hong Kong, and they should also monitor their health to look for infection risk. And this arrangement is on par with travelers from overseas and from Taiwan. Now, for inbound travelers, since they have done a PCR test before arrival, the risk of picking up a positive PCR test is rather low. But once or in case they are infected or found positive in Hong Kong, they will have to declare through our online platform of the Department of Health. And under the isolation order from the Department of Health, whether we talk about local residents or inbound passengers, inbound travelers, they can seek medical consultation on their own. Now, for travelers, they can use our private healthcare service providers and pay for their own medication. And they have already ordered 2 types of antiviral drugs, and that is Paxlovid and Molnupiravir, 2 antiviral drugs, and travelers in Hong Kong or non-eligible persons in Hong Kong can pay for such medication. But for non-eligible people, if because of emergency they attend a public health care facility, and if they are prescribed such drugs by the doctor, they will have to pay for it first before they can be dispensed with the drugs.
Another issue close to the heart of members of the public are fever medications, that is, those with paracetamol content. There are 765 over-the-counter medicine with paracetamol. In pharmacies of certain areas, there may be a shortage of a certain brand of painkiller stroke fever medication, but there is a stable supply of other brands with paracetamol. The government is actively procuring and stocking up relevant medication to meet demand. Within the public healthcare system, we have a supply of 5 to 6 months of use, an increase from 1 to 2 months before the epidemic. This level is sufficient to meet demand in the public healthcare system under Department of Health, Hospital Authority, designated clinic, as well as those patients using teleconsultation service. We have also made requests to local manufacturers. Half of the local manufacturers in the past months said that the production of medication with paracetamol has been increased from 13% to 100%. This is done to meet expected increase in demand. The government has also put in place additional procurement. We have set aside special stock apart from demand from the public healthcare. We will, if necessary, make use of this backup stock to support the private sector. We will also set aside a certain quantity for the use of the underprivileged. In addition, we do not rule the possibility that there may be restrictions on purchasing and selling of medication. If need be, we may legislate. In terms of vaccines, it is the policy of the Hong Kong SAR government to ensure that under the vaccination program there is sufficient vaccine supply for Hong Kong residents. We emphasize again that for non-Hong Kong residents visiting Hong Kong on a short-term basis cannot receive free vaccination under our vaccination program. For non-Hong Kong residents, they can use the service in the private sector. We understand that vaccine suppliers are talking to the private sector. At the earliest, they will make available bivalent BioNTech vaccine at a fee in the private sector. Let me say this again. The paid vaccine in the private sector will not affect the supply of a vaccine for the public sector. There are rumors online saying that vaccines will be available for non-Hong Kong residents. Let me emphasize that non-Hong Kong residents cannot receive free vaccines in the public sector under our vaccination program. We may have relaxed certain restrictions, but we will not give up. In the recent sewage surveillance program, as well as number of positive cases in the Center for Health Protection, we find that after Christmas and New Year, and with the relaxation of restrictions, we have passed the peak of the latest wave. Government experts also agree with this notion. We will maintain the sewage surveillance program and will continue to monitor the number of cases in public hospitals. We will conduct genome sequencing of cases. We will follow the advice of the WHO and monitor the development of the epidemic situation. Of course, on top of that, there is the winter influenza. Just like other places, with increased travel from overseas and from the mainland, it will bring challenges. We will endeavor to maintain the service of our healthcare so that we can effectively protect public health with the resumption of cross-border travel. We'll now hear from the Secretary for Transport and Logistics.
Thank you, CE. I would like to brief you on our traffic arrangements. The Transport Department, the Civil Aviation Department, and the Marine Department have liaised with public transport operators to ensure that during the process of gradual and order resumption of travel, there will be sufficient capacity to carry travelers from our border control points. As mentioned, there are 4 border control points where we can control the capacity through the selling of tickets, including the airport in Hong Kong, the 2 ferry terminals, as well as the airport, so long as they have valid air tickets or ferry tickets or and also ferry tickets, then they can travel into and out of Hong Kong. Airlines have greatly increased the number of flights to cope with the demand. For the Hong Kong Macau Bridge Hong Kong port, we have the shuttle bus traveling between Hong Kong and Zhuhai services will be boosted. As for our ferry terminals, the operators will gradually increase services from Hong Kong to Shenzhen and to Fukien, and the frequencies will be increased. And 3 land border control points will be opened, and you must submit proof of online booking. So starting from the 8th of January, we have the following arrangements. For those going through Fukien and Lok Ma Chau Spur Line, you can take the rail line or GMB or taxis or minibuses. And for Shenzhen Bay Port, you can travel on franchise buses, GMBs or taxis. And members of the public can choose to start from Prince Edward, Yau Ma Tei, Sham Shui Po, Tsim Sha Tsui, Wan Chai, or Causeway Bay. They can use cross-border routes. And as for Man Kam To border control point, you can travel across boundary buses traveling between Man Kam Tong and Shangshui. And if you like to drive your own cars or hire cars through the Hong Kong Macau Bridge, Shenzhen Bay Port, or Man Kam To border control point, both drivers and passengers will have to show valid proof of pre-booking. Depending on passenger demand, where need be, we can boost traffic services at different control points. We will deploy extra manpower to provide the necessary assistance to members of the public. Now, I'd like to talk about the cross-boundary express rails, the XRL. You would like to know when it can resume operation. As we all know, it has suspended service for almost 3 years. It takes time to carry out drills and to carry out tests of its systems. Whether we talk about the MTRCL or the captains or relevant staff, they need time to familiarize themselves with the procedures. And from Hong Kong to Guangzhou, to ensure safe and steady operation. Now, for captains from Hong Kong side, there are already 40 of them. And for the mainland section, they are operating in a normal manner. We need to take vacant time slots to carry out the drills. So the XRL will resume service no later than the 15th of January. We will resume operation of the West Kowloon Station, Fuktian, Shenzhen North, and Guangzhou North. Now, from West Kowloon to Guangzhou East, services will resume on the date of resumption of the XRL. That's all for transport arrangements.
I will now defer to the Acting Government Chief Information Officer to give you information about online booking. I'll defer to Mr. Tony Wong. Thank you, Chief Executive. Friends from the media, members of the public, good afternoon. As we've heard from the Chief Executive, the Hong Kong SAR government will put in place an online booking system for Hong Kong residents and visitors to Hong Kong who are not mainland residents to make booking to travel to the mainland via Shenzhen Bay Border Control Point, Mankamto Border Control Point, as well as Futian Lok Ma Chau Spur Line Border Control Point. In relation to the Hong Kong Giant Macau Bridge, it is for passengers and drivers traveling by private vehicles. For passengers on cross-boundary coaches, there is no need for them to make any bookings. Mainlanders returning to the mainland do not have to make online booking. The platform will be launched at 6 o'clock today. The platform is designed in a simple way for ease of use. For the first stage, bookings will be available between the 8th of January and the 4th of March, 8 weeks. Starting from the 15th of January, every Sunday at 9 o'clock, there will be a new week added. That is the 5th, between the 5th of March and the 11th of March. You can make use of the government portal to enter the booking system. The system is operating round the clock and is done on a first come first serve basis. Each applicant can make booking for 3 travel companions, and every applicant can only hold 1 valid booking at the same time. You will see that under the Hong Kong Gov portal, there will be an additional portal added to enter the online booking system. There is a prompt in the booking system giving you information about the arrangement and points to note. You have to provide your ID card number or travel documents, say for example, your passport. The next step is general information, your name, your gender, your ID card number, as well as date of birth. And if you used your Hong Kong ID card, then please make sure that you enter the date of issuance of the ID card. For travel companions, you may choose up to 3 persons. If there is no travel companion, then it's 0, which is the default. If you have travel companions or not, you enter the information, and there will be 3 slots for you to choose at the designated border control points. The system will then show available slots in the coming 8 weeks. Once you have selected the slot, you need to provide a phone number that receives SMSs. It can be a phone number of Hong Kong, of the mainland, or of Macau, as long as you are able to receive SMSs in Hong Kong. Then you choose the language of the SMS, and then you check all the information entered. If it's correct, then confirm your appointment. Afterwards, you'll be shown whether your appointment is successful or not. If it is, you will be shown a reference number, the designated border control point, and the selected time slot. You'll also be shown information required, that is, the booking, the proof of booking, the PCR result done within 48 hours, as well as a copy of your ID card. There is an option for you to save the information or save it as an image so that it can be checked when you cross the border. If you want to make inquiries, make changes, or cancel the booking, please remember to retrieve the booking reference from the proof of booking or from the SMS with the identity number provided. You can make inquiries, make changes, or cancel the booking before you make another one. That's it for my presentation. Thank you.
For your information, now because you would like to know the actual operation across the border when there is no quarantine requirement. Now, for Hong Kong travelers, so long as they hold a negative PCR test done within 48 hours, they will have to fill out the information in the health declaration card across the border. And once they are on the mainland, then the mainland authorities will, based on what's on the declaration, if you don't have any symptom, then you can go into the local community. But if on the card you have declared symptoms, then of course the customs officers will have to administer an RAT test on you, and then you will be dealt with or you'll be handled based on the result of the RAT. So for someone without any symptoms, or if after the RAT there is nothing to follow up on, can then go into the mainland community. And if the customs officers there spot any symptoms that require follow-up, will then decide whether you should carry out self-isolation or go into any facility, and then you can go. And so there will be no quarantine arrangements. Thank you. Now, I open the floor. Please use the microphone we gave you because we have quite a lot of reporters. So please ask no more than 2 questions. And please tell us the media organization you represent. The gentleman in black. See, good afternoon. Good afternoon, secretaries. I'm from CCTV. Now, the border control points will be reopened. With regard to the number of the border control points and the daily quota, what are the considerations? And how is it going to help the economic recovery of Hong Kong? Now, first, there has to be discussion on negotiation between the 2 places. There are 2 considerations. First, on the land border control points, now the quota is set based on orderly resumption of traveling to ensure that everything is safe, orderly, and there will be no chaos. Now, for the land border control points, there will be a large number of passengers, so we need to set some quotas. Beforehand, because the control points, land control points are spacious, so there used to be no quotas. So for this time round, we ensure that there can be order, and a PCR test are done within 48 hours before departure is required. So we consider the number of land border control points and the locations. In our discussion with the mainland authorities, we understand that there are works carrying on in some of the land border control points, and so they are not appropriate. And because space is limited and there are works going on, so it is our agreement that these land border control points will not be included this time round, and the Secretary for Security may want to supplement later. We also want to facilitate traveling of Hong Kong residents into the mainland. Now we will consider border control points that are most accessible to Hong Kong people, and there are border control points where small vehicles or vehicles are allowed, and we consider the traveling pattern of our residents as well. Secretary for Security. Now, in considering the border control points to open and also the daily travelers allowed. Now, because we haven't have any normal cross-boundary travel for a while, so we have to ensure that everything is orderly and smooth. So we look at the capacity. So we consider a railway, and we want to ensure that these border control points are accessible by transport, and whether the border control points are ready. As mentioned by the CE, some of the border control points have works in progress, and so they will be considered at the later stage. And also the demand. We have a daily quota of 50,000, and to achieve this, we decide on the number of border control points to be opened. So in phase one, we have come up with this list of border control points. Secondly, we will closely monitor the situation after reopening. We are going to keep an eye on the situation every day. So when it's proved that everything is smooth and orderly in phase one, we'll consider how we can boost the quota and increase the number of border control points. Governments of both sides will consider factors involving the operation. Now, authorities of both sides will share information covering their own respective areas, and then we will decide how many more border control points to open and how many more passengers should be allowed. As for the impact on our economy, is going to be tremendous. As we all know, starting from last July, we have been considering how we can resume normalcy in different aspects. In our economic aspect in particular, reopening the border will provide great stimulus for our economy. The flow of passengers as well as economic activities can then resume. We have business travelers and those for official duties and also for tourism. So we will gradually and orderly assume full normal cross-boundary travel. We will take a step-by-step approach, and we want to proceed quickly. As the flow of or exchange of people between the two places increased, and for our catering and tourism sectors, they will benefit, and then there will be more economic activities arising. Now, for public transport services such as GMBs, minibuses, and taxis, they will benefit. And with normal cross-boundary travel, then we can really unleash the potential of Hong Kong as a portal into the mainland. There are people, there are foreigners who would like to go into the mainland through Hong Kong. So we'll then be able to attract overseas talents and enterprises to Hong Kong. This new development will have a positive impact. We want Hong Kong to restart, and we can scale new heights in the international arena. And 2023 is going to be an exciting year for Hong Kong. So we are going to achieve a full normal cross-boundary travel in an orderly and gradual manner. And I believe this can be achieved as soon as possible. It all depends on whether we can do it in a safe, orderly, and smooth manner. I'm sure everyone is looking forward to this, and it is something we have to go through the role of normalcy. We want to resume everything before 2020, that is before the epidemic. And I think normal cross-boundary travel is an important step.
Next, at the back, towards the left, the lady. At the back. I'm from Singtao. I'd like to first ask, well, we were waiting for 30 minutes. Is it the case that there were some last-minute changes? That's why there was a delay? Just now it was mentioned that there will be 60,000 in the quota, but that excludes mainlanders returning to the mainland and Hong Kong residents coming back to Hong Kong. So are we talking about 100,000? What about same-day travel? Is it allowed? If that is the case, overseas countries may impose further restrictions on Hong Kong people traveling to these destinations. Are you concerned about that? What we want to do is that we will release sufficient information for your use. We'll first have to consolidate and collate the information. We aim to give you most comprehensive information as much as we can. As I've set out the principles very clearly in relation to the quota. For land border control points, most important thing is that everything is done in a secured as well as orderly manner. We make use of the PCR negative result done within 48 hours as an effective tool against the epidemic. We, of course, want to maximize the number of people traveling as much as possible. We want Hong Kong to resume normal. In the half year after I have taken office, there was a strong voice asking for resumption of normalcy. And this is something that is inevitable. Some people would like to see it come as early as possible. With the agreement of the central authorities, we have taken a huge step towards resumption of normalcy. I would say that we're almost there. I'm very confident about our risk management. PCR test done within 48 hours will make sure that the risk level of inbound travelers is controllable. And as I've said on the last occasion, we have over 2.5 million people who have been affected. The overall immune barrier is effective, and that's also the view of experts. The risk from travelers from the mainland is controllable. We have sufficient supply of COVID medication, and we have a very sound healthcare system. So we do think that the opening of the border and the relevant risk will be kept under control. In relation to restrictions of other countries, I do believe that these other places will understand that the situation in Hong Kong in relation to the epidemic is under control. And the opening of the border will bring us closer to the, the situation experienced by other countries as well. And we all want the same goal. We're only one step short of reaching our goal. So I can say that the only restriction we have is the isolation order as well as the mask wearing requirement. We have come a long way. The international community is aware of what we have achieved. And of course, we will do our best to make sure that they know about the actual Hong Kong situation. The lady in black.
Some English questions from RTHK. So, why do the authorities think 60,000 is an adequate quota? Are there any factors that you have considered when setting this up? And will this cap be increased gradually and even scrapped in the end? And the second question, are you worried the number of COVID cases in Hong Kong will increase after the resumption of quarantine-free travel with the mainland, given that there are still 10 to 20,000 of cases every day? Can our medical system cope with this? Thank you.
Well, first of all, in deciding the number that we think we can very orderly and safely managed at land crossing, we took into consideration several factors, which include the geographical layout of the crossing area, which of course will have a bearing on the number of people that can pass through safely and orderly. The second thing is we want to ensure that it will be done step by step, so that we can very safely look at the actual arrangement, because we want things to proceed under our control. And that is the common understanding of both the Hong Kong government and the mainland authorities. My personal inclination is, if factors permit, I want to allow a large number of people to go through, because that has been the voice of a lot of people, both locally and overseas, wishing Hong Kong to proceed to normalcy as quickly as possible. And I have been hearing this voice since my assumption of duty. And that is why all the strategy and measures that have been planned and implemented are towards the goal of normalization and normalcy. So this is the first step. When will I take the next step? Of course, I will have to seek the endorsement of my counterparts, because crossing, as it means crossing the boundaries of the two places. So agreement has to be sought, but the common purpose is very obvious, that we both sides want normalcy to happen orderly, but as fast as possible. So after this 60,000 number, which is really for consideration of crowd management, I wish to proceed to the next stage, but that will have to be done as we monitor the situation upon the normal resumption takes place on the 8th. As to the number of crossing points that will be allowed to operate, I have explained in Chinese that we will, of course, look at this 50,000 number of people to see how many crossing points we should open so that we will be able to handle this number of people also to the convenience of the travelers. And you asked when I will scrap all the measures. As I've explained, the return to normalcy is the wish and wants of a lot of people, both locally and overseas. So I would in due course, depending on the time, at some point, will, of course, wish to lift all the restrictions. But that has to be decided as we progress so that things will happen orderly and safely. At the same time, under our control regarding the risk concerning COVID. Will the medical system cope? I will later hand over to Professor Low, but I have explained it many times. The strategy now is to focus on ensuring that we can control the number of serious cases and death cases, at the same time raising awareness of people to protect themselves through vaccination and through some safety advice, health advice. And I have explained many times, and I think there's general consensus that people in Hong Kong generally knows how to take care of themselves after 3 years COVID experience. And even though we have a high number of cases recently, we have already apparently passed the top of this wave. That means the medical service, having been able to cope, even when this wave has reached its climax, gives me the confidence that they will be able to continue to run the medical service, the public health service, efficiently and effectively. I thank each one of them sincerely for the commitment, devotion, and professionalism. And that is exactly the reason why I'm so confident that they will be able to ensure that the risk is well managed. I would like to pass over to Professor Low to see whether he has anything to supplement.
Thank you. Thank you. Hong Kong has always enjoyed a very high standard in healthcare, and which is actually provided by a dual-track system. We have the public healthcare system as well as the private service. Over the past 3 years during this pandemic, we've been increasing the resilience of our healthcare service in combating COVID, as we can compare in the year 2022 as compared to the early part of the year when we get into the huge tsunami of the COVID cases. We have serious disruption of the healthcare services. But over the last few months, despite the surge in number, as well as especially recently with the peak at almost 30,000 COVID positive cases, our public healthcare system has been coping very well with the service. Even though we are under pressure in this winter surge, our staff, our colleagues have worked very hard to sustain the healthcare service, and which is also contributed by the collaboration by our private sector healthcare workers as well. So I would say that we have learned from previous experience, and we're now our healthcare system, with the collaboration from both the private and public services, is now ready to cope with the service. With the border open, I must emphasize that during the COVID pandemic, quite a large number of Hong Kong citizens were not able to return to Hong Kong for service. And the SAR government has actually tried to collaborate with, for example, the University of Hong Kong Shenzhen Hospital to provide service for these Hong Kong citizens. With the border open, we welcome actually some of these Hong Kong citizens back, because this is our public service, our public healthcare system duty to take care of them. But we would like to take the opportunity to continue the mode of cross-border healthcare service, and we will be exploring more of these cross-border services so as to provide a more convenient and more efficient service for them, even if they are not they're staying in the Greater Bay Area. So this actually provides an opportunity for us for cross-border healthcare service collaboration. For those who are non-entitled, i.e. the visitors from overseas or from the mainland, as usual, as in the past, the majority of these healthcare service for these people are provided on a fee-for-service basis by our private sector colleagues, and this will continue to be so. Only the very exceptional emergency ones and some which has really need to be provided at the public service sector will be done at the public hospital. So the majority of these will be on a fee-for-service basis in our private sector. Thank you.
I would like to add one important point is the risk control is done by the 48-hour PCR test. That is, I think, a very key control measure to ensure that those who are already infected will not be able to come. I just want to remind each one of you of this important control measure.
下一位提問，左手邊。
Next, the gentleman in white on the left-hand side. See, and good afternoon, everyone. I'm from TVB. For the first phase, the daily quota is 60,000, but you haven't included mainland residents going back to the mainland. Now, in terms of our transport capacity, do you think we can cope? Because how many mainlanders will be returning to the mainland on a daily basis? There are cross-boundary vehicles saying that we're not yet ready. So if we include mainland residents return to the mainland, we may have 100,000 travelers per day. And now for people from Macau, it takes 9 days before they can go to Zhuhai. Can you discuss with Macau so that they can do away with this requirement so the Hong Kong residents can go to Zhuhai through Macau? I will say a few words before I pass the microphone to the Secretary for Transport and Logistics. Now, our arrangement with Macau is relatively simple because according to our assessment, the daily travelers between Hong Kong and Macau is around 6,000 to 7,000. The figure is not high. So we'll discuss with the Macau SAL and then we'll announce the details later. Now today, the press conference is mainly on a normal resumption of normal travel between Hong Kong and the mainland. And as I said, one way, the number of travelers will be 60,000 per day. I now give the floor to the Secretary for Transport and Logistics on the transport capacity. Thank you, CE. Now, there are two types of transport facilities. First, we have air tickets and also train tickets to control the throughput. And these control points will be able to ensure crowd control without any booking. And so no booking is required. But for Mekam Tow and Lok Ma Chau and also Shenzhen Bay, we have reserved substantial capacity to take care of the demand that exceeds our assessment or anticipation, because at these border control points, we have quota control. For northbound travelers and southbound travelers, i.e., Hong Kong residents returning to Hong Kong and mainland residents returning to the mainland, they are not included in the quota. We have set aside reserve capacity to take care of such passengers or travelers. As we all know, for Lockmart Charles Bur Line, it is in fact a railway border control point. The capacity is high. The Lockmart Charles Bur Line used to carry 90 departures every day before the pandemic. We have now boosted that by 50%, so there will be 135 departures after the resumption of normal travel. So I'm sure we have sufficient capacity. In the interest of time, we'll allow 2 more reporters to ask questions.
The one in green. I'm from Ming Pao. First question. For the first stage, how long would you observe before deciding whether to start the next phase? Have you considered exemptions, say, for example, for people traveling for funeral or for weddings? Would you consider giving them exemptions? So far, we have heard nothing about this. Do you think that people will swarm to buy ferry tickets and train tickets, causing speculation? Please be succinct. Last time, the chief executive mentioned that there are differences between the vaccination requirements on the mainland and on Hong Kong. Have you considered whether to impose vaccination requirement on people coming from the mainland? If not, why not? Will it lower Hong Kong's general immunity barrier? After the 8th of January, 50,000 people will be traveling via land border control points, and another 10,000 via other border control points. We'll closely monitor the situation. We want to make sure that everything is done in an orderly, gradual, safe manner. If our targets are met, it will give us confidence to start the next stage earlier. We'll closely monitor the situation. However, I am optimistic. With the support of the general public, it will help us reach the next stage earlier. Of course, we will have to discuss with mainland authorities first. Regarding exemptions for people with special needs, the quota we have set are quite large. There will be a maximum of 60,000 people traveling each way. That means over 1 month, 1.8 million. Over 2 months, 3.6 million. That is half of our population that can travel to the mainland over 2 months. We have an online booking system. A person can only have one valid booking. If you want to make the next booking, you will have to complete your trip first. In other words, 3.6 million will be able to travel to the mainland in the first 2 months. As I said, You can only get the next booking after you've completed the first trip. Available slots span over 8 weeks. That is to make it more convenient for people to plan their trips for business purposes or for personal purpose. Well, that means over that 8-week period, you can only make one valid booking. We think that this will meet the overall need. And the booking system is done under real name. So there is no chance of speculation. We think that we have taken care of people with urgent needs. And as to when the second stage will take place and whether more border control points will be open, we will review the situation after the first stage has started. Our principle is that we will try to be as flexible as possible towards the goal of resumption of normalcy. If we are successful in the first stage, I believe that the pace will be quick. 8 weeks are available for people to choose from. Maybe before you plan your trip, there will be new measures. You just have to wait. You have asked another question. That's in relation to vaccination. We have introduced great changes under the border opening arrangement. We're talking about 60,000 people traveling northbound and another 60,000 southbound. Our principle is that everything has to be done in a gradual, orderly, and secured manner. We try to keep everything else the same. This will give us more certainty. And of course, we will deal with these matters at the right time. Questions from the last reporter, the gentleman in white. I'm from Hong Kong Economic Times. First question in relation to the booking system. Just now, the chief executive said it's first come, first serve. What about elderly people? How can they make the booking online? And if they miss the chance, that they will have to wait for who knows when. You mentioned about opening of the border in an orderly, gradual manner. Can you give us more specifics? You said that if there is smooth running, then the next stage will start. Will you review the situation once a week? Before or after the Chinese New Year, will you be able to tell us when the quota will, by how much the quota will be increased? I do understand that is a matter that's close to the hearts of a lot of people. We understand that we're expected to be able to do it in the review. I may be as anxious as you. I want to increase the number and the quota as much as possible because we want to resume normalcy. That's our ultimate goal. However, I have to say that we have to be pragmatic. I can tell you that we're of the same mind. We want the pace to be quick. Chinese New Year is around the corner. I understand that people expect more things to happen. I will keep a close eye on the situation and maintain close liaison with mainland authorities. I do understand that elderly people may not be as savvy when it comes to using the internet. That's why we have made the arrangement of making bookings for traveling companions. So your family members can make the booking for you as long as the information supplied is correct and everything is done under the real name. We try to take care of people who are not tech savvy. From my experience, that this is not a major problem. In relation to the booking system, I would defer to the Secretary for Security. The principle is for things to be done in an orderly, gradual, and secured manner. Well, if you're late by 1 minute from as compared to your appointed time, of course there is some degree of flexibility. But I advise members of the public to make time for unexpected delay. You have to bring all the documents with you. Please follow the slot you have chosen, otherwise we will not be able to do it in an orderly and gradual manner. I do believe that the majority of people will accommodate, and because that is very important. So please keep to the time you have selected. Well, if one person failed to do that and as a result others are affected, I don't think that will be a very good thing. And I expect everyone to respect our system, and I am confident that everything will be operating in an orderly manner. That's the end of the press conference. Thank you. That's the end of the press conference. Thank you very much.